Thanks for joining me on Faith Check News. This week, everybody's railing about Trump's tariffs, and I kind of wanted to take a moment to talk about something totally different, but really still just as important, our healthcare system. Earlier this week, special government employee Calley Means sat down for an interview with Politico to talk about RFK Jr.'s plan and what he was going to accomplish there with the Make America Healthy Again. And so when he sat down, a lot of people have focused on sort of the contentious moment. Most of the people in the audience are lobbyists for big pharma and big food and government employees. So there's actually sneering and jeering and laughter and even outburst of comments from the audience. So it's kind of fun to watch the whole thing. I'll put a link down below if you want to watch the entire 40-minute interview. So what I did is I basically just pulled a couple clips I wanted to share with you to ask the question, are these people cray-cray?
Check the mic and make sure it sound right, boys.
When we talk about the two prisms of MAHA, about let's get American patients the truth and then have flexibility, foundationally, and Bobby said this defiantly last week, food is medicine. We spend $4.9 trillion now on healthcare. 90+% of healthcare costs go to foodborne illnesses, essentially, go to chronic disease, which are interconnected. So what President Trump and Secretary Kennedy have talked about, it's not pro-business, anti-business, it's anti-corruption. We should have scientific guidelines that are not corrupted by industry that tell Americans the truth. We should have transparency for American consumers and lawmakers of what is in our food. We should start with transparency and the truth.
Still, I know a lot of you are thinking, all right, but the way the Trump administration has handled this reform of the federal government and Make America Healthy Again has been reckless. And Calley Means answers that with this.
Any business in the world, if you went into it with the metrics that the HHS has overseen, with skyrocketing costs and as costs skyrocket, worse and worse outcomes, with extremely little innovation from industry on actual chronic disease reversal and prevention, just management, you would of course fire a bunch of people. And you would of course install new leadership to put that mantle down. And this is a group that wants to work with industry, but is absolutely defiantly saying we need a new direction.
This is a really important point, and there's a lot more to Calley Means' comments there than what I'm showing you. I'm trying to keep it short, but I hope maybe you might find a little bit of reassurance in the fact that he's not saying we want to be retroactive and go back and seek vengeance for all of the terrible things that big pharma and big food have done to the American people. What he's saying is, let's view this as an existential crisis. Something is really wrong, and we need to figure out exactly what that is. And the first place to start is transparency. I'm not even sure who could be against transparency, but a little bit later I'm going to play a clip, and Calley is going to explain to us the fact that the FDA doesn't even know what's in our food. So the organization is supposed to be overseeing the food industry doesn't even have a list of what's in our food. But that's a little bit later. So what Calley keeps pointing out is that the fundamental problem with our public healthcare system is that it's become a sick care system where they're just managing the problem and not trying to solve it.
What the voters are trying to say, and I think they were right, is that the system is really on the wrong track. That the existing health authorities just demonstrably, the NIH oversaw, and this is just consensus at this point, the literal creation of a pandemic. The NIH, whose goal is to promote American health, has overseen a devastation, just an abject devastation in American health over the past 20 years, with disease rates skyrocketing in America, leading the world of almost every single chronic disease, with rates of nearly every single chronic disease being at an all-time high among kids. There's been very little innovation with small pharma, with innovative therapeutics at the FDA. It costs $1 billion to get through the process. CMS is an agency that's much larger budget than Defense Department, that's controlled by the American Medical Association, which is a pharmaceutical lobbying group and is almost predominantly sick care.
One of the points made in this conversation to prove that public health officials have been essentially captured by big corporations is the fact that of the past 12 FDA commissioners, 11 of them took jobs in big pharma or big pharma related industries after leaving their commissionship. I wonder why. And to me, that kind of gets to the heart of this political battle that you see on the nightly news, where you have multiple people going back forth in these emotional arguments. They're missing the point. Food is medicine. When we eat healthy foods that are designed for our body is healthy, and we avoid a lot of disease and other health problems, right? Well, the opposite is true. If we eat junk, if we eat chemicals, if we eat preservatives, things that our body is not designed to process, we end up being unhealthy.
Becoming healthier can be expensive. Right now in America, getting food that is better for you costs more, and it is such a barrier for lower income Americans that also have the worst health outcomes. So how are you planning to bring down the cost of being healthier in America?
Yeah, one thing Bobby Kennedy is not going to do is entertain comments from food industry lobbyists using food prices as an excuse to continue poisoning children. Like, that's not going to work. And I know a lot of you guys are doing that, and I think if you really back up, that's an evil argument. That's the only argument the food industry is making right now. They're trying to hold a gun on food prices to literally not even dispute the premise that Americans are being poisoned. We have 10,000 chemicals in our food that are not allowed in any other country. Fundamentally, American food companies make their food with different ingredients than other countries. I mean, the food dyes has obviously been a flashpoint. American companies are making their products here with crude oil-derived food dyes and making the exact same product shipped into Canada with beet juice and carrot juice. So I think when this starts, Bobby's going to, and Secretary Kennedy's going to first talk about transparency, and that's what he's done. He's talked about GRAS standards. Fundamentally, what he's asking for is we need to understand what's in our food. The FDA currently does not have a list of what's in our food. They do not have a list. It's self-policing. So he's going to work with the NIH, work with the FDA to have a list of what is in our food and have post-market review of those chemicals. There's a lot of lobbying to actually prevent even transparency about what's in their food. There's voracious lobbying from industry about preventing, that's going to embarrass us. That's going to make us look bad. We, at the baseline, what Bobby Kennedy's saying on food is we need to know what's in it. We have to have accurate science on the chemicals in our food.
So what do you think? Don't listen to the noise. Go listen to these people. This interview was something like 40 minutes long. I tried to call the best moments of it to kind of portray, the message of MAHA and what they're really trying to accomplish. If you don't believe me, I'll put the link below and you can watch the full video for yourself. That's today's Faith Check News. I'm Brian Tennemore, and remember, food is medicine.
First step of MAHA is acknowledging the truth so we can all make decisions and get to a place we probably all agree with, which is a system that reverses and prevents disease, a system that gives patients more autonomy and choice over their health care.